I believe we are live now. So welcome everyone. My name is Paul President. I'm a resident in New Rochelle, New York, and also am the co-founder of a company I created with my father called Sustainable Process Solutions. We are currently right now social equity candidates for a cannabis processing license where we are looking to blend the intersection between clean technology, sustainable processing to make sure that we're doing our best to help support the New York State cannabis industry being in alignment with the 2019 Climate Leadership and Community Protection Act. There's a lot of clean jobs that are available that a lot of people could be able to showcase through the cannabis industry. And we know that there is a lot of historical benefits of the cannabis plant with climate practices, renewable, sustainable practices, transitioning away from single-use plastic, regenerative agriculture, and some of the needed resources that we need to combat deforestation and protect our timber industry. But we're not here to talk about the environment. We actually did that at a past event. Safita and myself, we are here to talk about the intersection between the cannabis industry and holistic Black healthcare. We are here with a dynamic panelists, but I first want to give a shout out to Mr. AJ Woodson, the editor-in-chief of Black Westchester Magazine, who graced us with being to be a co-host and co-moderator for this event so that we can have this authentic dialogue on a Black media platform. AJ, do you want to give a couple of words about yourself and also share a little bit background on what Black Westchester Magazine and what encouraged you to kind of create this media platform?
Exact. Absolutely. Excuse me. My name is AJ Woodson. As you just said, I'm the editor-in-chief and co-owner of Black Westchester, both an online magazine and a print monthly newspaper. Give you the news with the Black point of view. We started this 10 years ago because we felt that there wasn't the way we were being portrayed in the media. We wanted to change the narrative. We wanted to tell our stories. We had no media. We had another paper, the Westchester County Press, but sometimes they don't get into the more serious issues, politics, holding elected officials' feet to the fire. So we created this format, and now we become the voice of the voiceless, and we fight for those who can't fight for themselves. We helped a couple of elected officials get in, and a few of them acted up, and we helped them get right back out. And we've helped a few wrongfully incarcerated individuals get out of jail, and the cops that lied on them went to jail. If you can call 8 and 20 weeks of weekends jail, if you can call that jail. But they did go to jail, and we've caused a few others to lose their job and be suspended. And this is what we do. We just tell it, give you the news with the Black point of view. We have also a weekly radio show, People Before Politics, give you real talk for the community. We cover anything that our community faces. And so we deal largely with Westchester, but all the surrounding areas. We deal with all the national issues and everything too.
Awesome. Thank you so much, AJ. And your work is very important because I don't know too many county-wide media outlets that is Black owned and specifically is targeted for our Black community. So thank you for everything that you're doing. And also, again, thank you for providing us a platform to be able to have this dialogue and making sure that we get it out to Black-owned and community-based organizations that are supporting members of our Black community. So going back to our panelists, I'm going to read off a couple of bios that I have here, but I first want to kind of start off with the brainchild behind this event. You know, it was a conversation we're having about how we can really combat some of the reefer madness or things that are really people that are, you know, some of the presuppositions that are stigmatizing our industry and kind of preventing some the embrace that we need to be able to unleash the full potential of our cannabis industry. And I do want to give a shout out to National President Safita Artis Mills for the amazing work that she's been doing, not only here in New York State, but across our nation. For those of you who may or may not know Safita, I hope you all connect with each other. Safita is a dynamic leader. You know, words can't say the amazing things that she's been doing. She's a community and thought leader, doing amazing work out of New York City, also throughout state of New York, helping blend the intersection, leveraging her business background and her education to make sure that there's a just transition for our legal cannabis market. She has a business background, but also did not lose touch with her roots, working with members of the legacy market and kind of bridging the gap for some of the intangible skills gaps that are needed for people to know what are the business practices to be able to set up an entity and be able to hit the ground running in this emerging legal market. Safida is also national president for the United Empowerment Party, formerly known as the National Cannabis Party, a federally recognized political party that is organizing to aid the support of education in cannabis, specifically in medicine, jobs creation, and some of the needed nonpartisan outreach to develop a cannabis program in New York, in the United States of America, that will streamline deschedulizing the drug, also legalization, and also making sure that it is inclusive and economically sustainable as an industry for residents of all socioeconomic background. Safida is a dynamic leader. Words can explain the support she's given me as I've been, looking into the industry and looking to how to build the authentic supply chains within some social equity partners that exist. So I do want to thank you, Safida, for really bringing this program to reality. We had a conversation and you basically said, let's do it. And here we are now, bringing together this conversation for people that are all throughout our region to be able to listen in and tune in. And next person I would like to introduce is the Honorable Chairwoman Tremaine Wright, who is the inaugural chair of the New York State Office of Cannabis Control Board for the Office of Cannabis Management. In this capacity, she is charged with leading the deliberation of regulatory and tax policies for New York's cannabis industry regarding both medical and also adult use applications throughout the entire state. Chairwoman Wright is also a former member of the New York State Assembly for the 56th district, representing Brooklyn. Also, Safida has her roots in Brooklyn as well, too. So I see some synergy right there. And also, Chairwoman Wright was the chairperson of Community Board 3 within the borough of Brooklyn, and also as a small business owner through ownership of a neighborhood coffee shop. Chairwoman Wright also is, some of Safida is leveraging her professional background to make sure that everything is being done to be able to empower people within this industry, leveraging her legal background for the University of Chicago Law, and also being a graduate from Duke University, where she has previous experience in law for both private and public defenders for Brooklyn Law Services. So thank you as well, Chairwoman Wright, for everything that you're doing in terms of making sure that we're leveraging our subject matter expertise for people that unfortunately were not able to have the educational journey to be able to achieve the knowledge that they should have to hit the ground running. Next speaker I'd like to have is to introduce is Kebra Smith Bolden, a registered nurse based out of Connecticut and the Chief Executive Officer of Canna Health, a holistic cannabis health and wellness center, and the market leader for Women Grow Cannabis, Women Grow Connecticut, a network organization that empowers women to become entrepreneurs in the cannabis industry, and most importantly, be able to have a sense of ownership in this industry, not to be laborers, but also to become the business leaders that we need to show that there is this dimension of gender equity and most importantly, equity for people of color within this emerging industry. She also is the president of the Connecticut chapter of Minorities for Medical Marijuana and the co-chief nursing officer for the steering committee of the Huerfano County, Colorado's Ferris Green Campus project to fight opiate addiction with cannabis. Kebra, you're doing amazing work, and the fact that you are taking such leadership through the industry, through this perspective of a registered nurse, is dynamic, because this is really how we can show, through hands-on applied leadership, and also people to make a point, such as yourself and Ashley, who I'll introduce very shortly. It's important that we know that these holistic pathways do exist. Otherwise, people unfortunately are getting caught up in the cycle of the medical industrial complex, if I'm allowed to use that word, where they're not being treated for the core diseases, but they're being prescribed for different symptoms and having cans kicked down the road. So thank you for everything you're doing, and also the work that's being done by Ashley Wynn Grimes, who is a Baltimore, Maryland native, a Black female entrepreneur and a registered nurse for more than 12 years. Ashley Wood Grimes, who has her Bachelor of Science in Nursing, is the founder of Cannabis Nursing Solutions and also is a published author for Stigmatized and also the children's book Asa's Medicine. Ashley's work is dedicated to empowering patients and nursing professionals to make informed wellness choices with impactful educational medical programs that also serve to promote diverse representation and increase resiliency amongst the communities that she serves. Ashley has an impressive career that spans many years and has worked in various different healthcare settings, including telemetry medicine, quality improvement, and professional development. And also, Ashley, similar to Kebra, has been responsible for a lot of trailblazing work in non-traditional cannabis patient care programs. But Ashley's work is historical for what's been happening in the DMV area, specifically in the state of Maryland. It has historically offered a lot of standardized approaches to dispensing cannabis for nursing professionals and children in school settings. So really help bring a renaissance to what we think cannabis nursing education should be in the future. And also, I would also like to give a shout out based upon your bio that you also are a Reiki master, really making sure that you're leveraging your energy healing practice as well. You're dynamic for holistic medicine. I'm also seeing that we aren't joined yet by Mayor Sean Patterson Howard. I will kind of when I pass the torch on to AJ Woodson, I'll be able to see if she'll still be joining us. But just to give a recognition to Mayor Sean Patterson Howard, she is the first female mayor in the history of the city of Mount Vernon. The city of Mount Vernon has the largest Black population percentage for any municipality throughout the state of New York. She also is the immediate past president of the National African American Mayors Association, help support a network of Black mayors throughout the United States of America, and also is currently right now the president of the Westchester County Municipal Officials Association, an association of city council members, mayors, town supervisors, and village trustees, town board members as well throughout Westchester County to help make sure that we're supporting intermunicipal conversations on shared issues that impact communities across Westchester County, New York. So I do want to thank Mayor Patterson Howard for agreeing to join us, and we would like to make sure that we do recognition and have that conversation. So with that being said, I would like to give the floor to Mr. AJ Woodson. AJ, if I know we have a couple of questions that we like to have asked. But first, because I know we do have a distinguished guest in terms of the Honorable Chairwoman Tremaine Wright, I do want to give the floor if you want to give any opening remarks or anything that you'd like to share to address us, because we are really honored and blessed to be able to have you taking time out of your very busy schedule, leading the entire New York State cannabis industry, and joining us for this dialogue.
Thank you very much. Can you hear me?
Yes.
Okay, thank you. Well, thank you very much for having me this evening, Paul, AJ, everyone on this panel. It's really a pleasure to be a part of a medical conversation. And I'm actually going to stop using the phrase medical. We were just talking about this today. It's really about patient care and really figuring out how we are addressing the needs of people. And when we think about what's been happening with cannabis in our state, since the decriminalization work, moving towards legalization, and now trying to build the industry, it really all circles back to how do we allow people to care for themselves and to do the things that are best suited for them, for their own success. So if it's healing, if it's stability, if it is nourishment, we want to make sure that people have the tools that are ready. And so we want to say thank you to all of the health partners that are here today. I look forward to hearing your presentations, hearing what you're doing about the collective work. And I hope that it helps to give shape to the direction we should be moving in New York. Because as we've seen across the country, our medical participants always begin to decline as the adult use market opens up. And so we have to be very deliberate. There are a couple of initiatives that we're trying to push here in New York State. including a call for papers and a academic symposium that's going to take place in September in Albany. And we really want to make sure that people are tuned in and engaged in this dialogue, because from this is how we're learning what direction we should be moving as a state. So thank you very much, and I look forward to listening in.
All right, thank you so much, Chairwoman Wright. So next, I'll give it to AJ to take the floor and also to share a couple of questions that we have for our panelists.
Okay, I'm about to ask a few prepared questions to the panelists. I did want to say also to all the experts on here, if you are writers and want to articulate something on this topic or whatever, feel free, always just email me and I will definitely publish the stories. We don't have enough stories from those in the know to speak on them. So question one, which is I think a community focused question, in what ways do socioeconomic factors influence the utilization of cannabis medicine in underserved communities? And this goes first to Safida.
Well, thank you for asking that question. I believe that it plays a very important role, because we know that culture is a very big part of community, and it is a driving force for community. So socioeconomic conditions are largely impacted by culture and how people perceive things. And I think in Black and Brown communities specifically, the stigma is a very big factor in how people think about cannabis and how they even see cannabis as it being medicine, or it being, the gateway drug, and all of the things that has been painted around cannabis. So I think it's really important to be able to change the way that people see cannabis, and understanding the medicinal benefits of cannabis and how it is individualized, and why there should be a focus around patient care, because these are things that can impact the community positively if people can understand the plant better, and then being able to build programming that's largely centered around the education that's needed, so that we can begin to put these practices in place around the current medical program that New York has, which is a very comprehensive program, and that I believe is one of the more forward-thinking programs, because of the way that cannabis can be recommended across multiple conditions. And I agree with Tremaine that it definitely needs to be upheld, because the adult use market, we don't want to drown out the medical program, and we want to be able to allow for other opportunities to be able to grow the medical program.
Okay. We also were going to let Mayor Sean Patterson Howard answer. I don't know if anybody else on the panel would like to answer that question.
Well, when we speak of communities of color, we have to realize that a lot of these medical cannabis services, and this is according to the National Institute of Health looking in New York, are not in Black neighborhoods. A lot of them aren't in communities of color, and so therefore aren't accessible. In Connecticut, that's the reason why I started Canna Health and put it right in the middle of my community, because we were expecting people to not only have to go and seek medical attention or seek medical advice and recommendations for cannabis in neighborhoods that are unfamiliar to them, but we're actually talking about cannabis, which is, as we just spoke about, the stigmas, the things that would make them uncomfortable. And on top of it, having to talk about their traumas, because that was primarily the diagnosis. And these were practitioners who didn't look like them, who didn't understand them. And so, I felt it was really important to be that in my community. But that's the case across the country, in New York as well. And we have to make sure that we're making our community members being able to access medical cannabis. Right now, I think they say on like a national level, 28% of of cannabis medically certified cannabis consumers are running about 28%, and 46% for white. So I want to make sure that we are even in those numbers because we know we're consuming at the same level and in the same rate.
On to question number 2, which is more of a healthcare focused question. What are the current barriers to accessing medical cannabis for Black and Brown patients, and how can these be addressed? And first, we would like to go to Ashley.
Cool. I feel like that question can piggyback off of the last question around socioeconomic status. I think the conversation as a whole is about health equity and being able to become aware of what we need as a community, as Black and Brown people. There's a lack of awareness when it comes to overall just health, ideas around health, like what does it actually mean to be healthy? What I'm actually eating, is that nourishing my body or is it harming my body? And do I have access to alternative options? And then accessibility is going to come up often, I'm sure, throughout the conversation. So can I physically get to a dispensary? But even further, like, I don't even think that dispensary should be the only place that we get cannabis from, because it's tainted. Like they letting it sit, is no love put into it. Like the energy just really isn't resonating with the healing energy that the plant could possibly have when we're getting it from the dispensary in most cases. Although I will say the button-up answer that Ashley would give to most patients will be go to the dispensary. But I think that really the conversation is about, can you access clean medicine? Can you access medicine that has been grown with love in a way that helps support our healing journeys? And then our ability to allow our trust in the healthcare system. It ain't there. Our patients, I mean, first of all, Black and Brown people were the ones who were tested in order to build this luxurious medical system that we're in nowadays, that we know is broken. And for that reason, a lot of Black and Brown people just do not trust the healthcare system, in addition to the day-to-day things that happen, the stigma that exists from practitioners onto the patient, and then even patients, the stigma they have amongst themselves, so they won't share, they won't do anything to allow that to happen. And that all feeds into the trauma, which is sourced in the war on drugs, all the incarcerated people, all the people who have passed down generational trauma that is sourced in slavery. And so at the end of the day, I don't even remember the question, but I know I answered it though. I know I answered it, but at the end of the day, it really is about making sure that our people are aware, they have accessibility, and we can provide a space that they can open up, to be trustful, to let their guard down in order to allow the medicine to do what it can do.
Okay, so we're going to move on to question number 3. What strategies can be implemented to increase research on the effects of cannabis medicine, specifically within the Black and Brown communities? And this question goes to Safida and then to the chairwoman, Tremaine Wright, in that order.
Research, that's something that I feel that there is definitely a lack of. I believe that the research has to be unbiased in order to really get the results that we want and need, especially understanding that Black and Brown people are different. Our genetic makeup is different, what we need is different, what our bodies need is it's very different from everyone else. So getting to an understanding of how individualized care is going to be so important. The research also has to be specific, and it needs to be geared towards what we need, especially understanding the traumas that we've experienced, the lack of resources when it comes to mental health care, because we know that is severely lacking as well. And it's not something that is touched on enough and even explored as to how cannabis helps when it comes to mental health, being that a lot of people are consuming and getting relief from anxiety and depression and things of that nature. So I think that there needs to be a clear pathway to being able to get to that research and being able to have individuals from our community, people that look like us, that can help conduct this research and be able to get to the solutions that we need, having real case studies, having data that is not tainted, as I say, because a lot of it is biased. And being that we know that there are industries that are on the horizon that are looking to jump into that space, like what can we put in place to make sure that the research is being done in a way that is going to be helpful to these communities that have been disproportionately impacted and that have been harmed the most. So I think it's going to be really important to ensure that that happens, and to also make sure that there are people who are currently experts and professionals in this space to be able to do that research and collaborate and work with institutions that can help foster that, from higher education institutions to medical institutions as well, like different hospitals, and getting doctors on board and being able to build that kind of programming. But being that New York has a research license and is the only state that has issued a research license, I think it's very important to be able to start building that type of programming and to be able to encourage people to apply for that research and to be able to build medical teams that can help conduct that research in a way where we can get the data and be able to help continue building the medical program here in New York.
Yes,
Chairman Wright.
I would agree. I would agree with everything Safita said. Research is going to be the key, and it's the core to our success. We don't know enough about the plant, and I think that as regulators, we've realized that the first thing and the most important thing was for us to find a pathway for people to begin engaging in this conversation. So the research license is there. And so, not to harp upon everything that's already been said, I just want to say that I endorse all of those statements. But I also want to add that one of the things that we've done was reduce the fees for people to receive their medical cards in New York State. We've gotten rid of those registration fees. We're hosting a symposium. It's a research symposium. We want to hear what people have already been doing. We have a pathway for what's already in the marketplace. What have people not had an opportunity to share because they're not being published somewhere? Come talk to us in September and share your research. Additionally, we think home grow is a very important component to this. A lot of people who, I'm going to say that they participate, they do both medical science, and they also do holistic science. And they need access to the plant. We believe that the home grow will provide people opportunities to access the plant, to make sure that it is clean, to make sure that they have direct access to it without going through into dispensaries. Because I do think you're correct. Going to dispensaries is an additional step that separates people from the healing properties of the plant. And I don't think that it always jives with people who are looking at it as a holistic approach to their health. So removing some of those barriers that we can remove as government, I think has been really key and important. But I think that research is our cornerstone.
So I keep muting myself, just full disclosure, where I am at a family member's house. They have two big Rottweilers and a little noisemaker dog. And every now and then I've been muting myself because they've been deciding to make a lot of noise right now. So if you hear some barking, that's what it is. So the next question is, how can healthcare providers ensure culturally competent care when recommending cannabis treatments to diverse patient population? And this one goes out to Kibra, and I hope I pronounced your name right, and followed up with Ashley.
Mm-hmm. Well, healthcare providers can provide culturally competent care by hiring people that look like the people whom they are serving. They can also educate themselves. So those same people, because I still think they should look like the people they're serving. So the people they're serving should also educate themselves about the community, know what the community needs, and really have a clear understanding of how to provide the information and access to communities in the language they can understand. In addition, I think that there's definitely a need and a responsibility to provide outreach and services. Like, you know, as a nurse who works in cannabis, I would go and speak at churches, at senior centers, to really help people understand that this is medicine. You know, we keep talking about the stigma that has been so prevalent for the last almost 100 years. And so it's important that we are unpacking that and allowing people to have their real feelings. You know, grandma's grandson went to jail for that bag of, you know, weed. And so how do we, you know, kind of help them to deal with their trauma surrounding cannabis and begin to look at it differently as medicine? So I think those 3 steps at least are one of the most important steps.
And Ashley.
I agree with everything she said. You know, as healthcare providers, one thing is that we're supposed to provide unbiased care. And the unfortunate reality is that we're very biased when it comes to cannabis medicine, regardless of if we choose to consume it or not. Like we're like, our self-talk is really negative when it comes to what that looks like. And a lot of people, a lot of nurses and healthcare providers, they all like to smoke weed. They don't like to talk about it because they're scared they're going to lose their license, but they be doing that what they want. And so the first thing is that they need to talk about it, and they need to be okay with the fact that that's what they're choosing to do. Because how you going to talk with a patient about what they choosing to do if you too busy hiding in the closet yourself? So the first thing is, I think healing for ourselves. A lot of us are dealing with burnout and unable to create that space and time with our patients and our clients. And I think our patients and our clients need that time and space to be able to unpack, like Keeper was talking about, you know, what they need, what their symptoms are that they're dealing with, and be able to correlate that to what cannabis can do to help. And then the healing is generational, from grandma to grandson, you know, mom to dad, husband and wife. Like, people are hiding this all over the place. And so creating that space, being able to go to community events and spread that awareness and have those conversations. I mean, daggone, we don't even be wanting to talk about diabetes half the time. Like, people's feet be really literally about to fall off in real time. And we don't even want to talk about that fact, you know. And so I think that the biggest thing is surrounding healing and supporting that healing process, and not just from a physical perspective, but from a emotional, mental. You know, mental health is so stigmatized too, and a spiritual perspective, because that all contributes to the healing process. So yeah.
So I want to interject real quick before I get to the next question. And Keeper was talking about speaking at churches. So, and I'll make it very quick. So when I lived in Atlanta, I went to a biblical institute through my church, which teaches first-year seminary classes. Some of the herbs that they talk about in the Bible, one of them was cannabis. And the redactors took the word out or reworded it, replacing it with something else, because they did not want that in there. But even in the early days of the Bible, cannabis is in the Bible. I just wanted to put that out there because most people don't know. And I think a lot of preachers, there's people preachers that don't know, but it's in there. So then I'm going to the next question now. How does the industry of cannabis criminalization affect the perception and acceptance of cannabis medicine within Black and Brown communities? And this is open up to all the panelists that want to speak on it. I just ask that you keep your answers brief, your responses brief. Don't everybody speak up at once. Okay, go ahead, keep it.
I was just saying, you know, I just made a statement a little while ago about how, you know, a mother or grandmother or someone had an experience with someone being criminalized, and now they're just turned off to the idea of, you know, coming near that devil's lettuce, you know, or whatever. And so, you know, we have to, again, like, really just educate our community, help them think differently about cannabis, really kind of help people understand where this propaganda, where all this negativity started, where why this was made illegal. Like, it was just to criminalize Black and brown people. And so I believe if we begin to start having these conversations and really helping people understand the history of cannabis prohibition, the purpose and the plan of systemic racism and incarceration and all these things that are all working together to have made cannabis what the negative aspect that people have, or the way they look at cannabis, prevalent in our community.
Does anybody else? I noticed we have a few people that haven't spoke. Shamika Carter and Nicholas and Wisteria at Peoples. I hope I pronounced those names right. Or do you have any feedback on any of on this topic?
I think they may be.
Okay, not a problem. Go ahead, Sophia. Whoever want to answer next, and then I think Paul's going to open it up to the audience.
I'll definitely just keep it brief, but yes, I think that the criminalization of cannabis, it's definitely played a factor in how people are perceiving cannabis. It was the lowest hanging fruit for mass incarceration for Black and brown communities. It was weaponized against Black and brown communities, and it was there were laws that were put in place specifically around cannabis, deemed by Reagan as the most dangerous drug in America. And just there's so many more things that we can talk about that era and how it was specifically targeted against Black and brown communities. So if you look at the way that so many were incarcerated, how we were 3 times more likely in some states, such as Louisiana, up to 7 times more likely to be arrested for cannabis. Families that were impacted by that they don't want to touch it, or they will still look at it as the gateway drug. They will still look at it as something that is dangerous. They will not look at it as something that is medicinal and healing. And because of that, that is why we still are dealing with so many people who are still traumatized and who will still continue to look at cannabis as something that is dangerous, or something that is not helpful, something that is not that doesn't have any healing properties, because the federal government still has cannabis as a Schedule 1, which they say has no medical benefit, but yet we have medical programs, and yet we are also looking at a potential reschedule of cannabis, which does not federally legalize or federally decriminalize cannabis. So we are still experiencing the criminalization of cannabis even in a legal market, because there are still certain parameters in place where you cannot have more than a certain amount and things of that nature, which can still have someone arrested or paying fines depending on what state they're in. So there's still a lot more work to do in making communities feel more comfortable that are from Black and brown communities, and also making sure that they're educated and that we're helping to bridge that disconnect there, and making sure that people understand what this really is.
I'm getting ready to hand it back over to Paul, but I want to make one statement, though, to anybody who's watching now and who will watch later. Politics plays a role in everything, and that's why you have to get involved in creating legislation. Our current Westchester County District Attorney, who didn't run for re-election, once cannabis became legal, she went and overturned a lot of cannabis convictions in Westchester County, throwing them out, and there were hundreds that were on the docket to go to court, and she threw them out. So, we knew this going in, that's what her agenda was. We need to get involved in politics and see what these people are about and tell them what we want. And if they don't do it, we don't vote for them. And if they in there and they don't do it, we vote them out. So I just want to throw that in, because that is responsible. And that plays a part in everything. Politics is a participatory sport in everything we do. Paul.
Yes, so we have a couple of questions from our live stream that I will share. I guess we have time for about 2 questions. The first question I have, I guess it's more healthcare focused. It's for our registered nurses that are here as panelists. We know that cannabis is a new and growing, I guess, term in terms of a social norm. Have any of you faced any forms of discrimination amongst your colleagues in the nursing profession because of your background or your interest in the cannabis plant?
There's a general stigma about cannabis, but just about everybody that, once we dig into the real conversation, just about everybody is like, you know what? I smoke weed too, or my cousin do that too. And I think that the real thing that needs to occur is just the open dialogue. You don't have to admit that you choose to consume, because I know that it's a real issue as far as protecting our licensure. But to just have a conversation about evidence-based practice, that's well within our scope. And I think that being open to having that dialogue as a professional, I think needs to occur more often than not. But generally, from a personal point of view, every time I thought that it would be an issue, it ended up never actually being a real issue. And for those people, that one person who told me I was killing her son because I was talking about cannabis that one time, I mean, yeah.
I wish I could say the same, but yeah, I didn't. And maybe I don't know when, you know, definitely the times have changed. So in the last couple of years, there's been a completely different perspective that people have seemed to have, especially amongst the nursing profession. And, you know, legalization definitely played a part in that. But when I started, that bio that was read was really, really old. But I did a lot of work in Connecticut to help legalize cannabis. And so I was on the news all the time. Like I was, you know, up in our Capitol protesting. I was doing educational panels, so I was out there is my point. And it was not well received by employers. And now I'm an entrepreneur, so I had businesses, but I've always worked. I love nursing, hospice, and primarily home care. And I got called into the office and was told that if I wanted to, you know, continue to promote weed and marijuana and all the things they said, that I couldn't work there. And so I ended up not being able to be gainfully employed, you know, regularly for at least a couple of years in Connecticut. I almost lost everything because of it, because I was so out there. So definitely the times have changed. Now I definitely feel like there's more people who are open to it. I can get a job anywhere now, and they don't even test for cannabis because I'm a consumer as well. But that definitely has not always been my story. I've encountered and faced discrimination, not only from employers, but, you know, within my community, within my church, like different places. And like I said, I've slowly started to see a change in that. Now the little old ladies like tap me on the shoulder at church and like, you know, could you give me some of that good stuff? And so, you know, I'm able to help educate in a different way, but it took a minute to get here.
Thank you so much. And the next question, I guess this will be the last question before we go to closing comments. Will be, I guess this will be geared towards Honorable Chairwoman Wright. Is there any potential opportunities for New York residents to secure a cannabis nursing license in a similar manner that someone could secure a license for processing, retail dispensary, or any cultivation license? Are there any plans for New York to explore that in partnership with Department of Health or anything like that?
I'm going to say currently those are not on our agenda. I think that's almost like asking us if we want to now license cannabis attorneys. I don't think that the agency that manages the production and distribution of cannabis is actually qualified to stand in the stead of our medical boards or our bar associations. I think that we need to leave those. This is the personal Tremaine speaking, the chair speaking, not the entire body. I think that those are best left to those professional licensing departments. But we do encourage all professionals to figure out how cannabis can help grow their businesses and also what benefits it would bring to their practices.
Understood. Like the separation of church and state. Sounds good.
But can I just say, if that person is interested in cannabis nursing as a profession, there are organizations, the American Cannabis Nurses Association, and actually the ANA, the American Nurses Association, now recognize cannabis nursing as a specialty, and so there are opportunities for professional development. Really honing in on that specialty and becoming certified, as well as if someone is interested in becoming a cannabis nurse or doing cannabis nursing, that could equate to business. So I'm a licensee in the state of Connecticut. So all this talk about don't go to dispensaries, I am an owner of a dispensary who will engage differently with my my patients, the people who come and purchase from our dispensary. So don't be completely turned off. There will be people who look like you, who are owning dispensaries. That's what social equity is about. And a lot of us plan on doing things differently. But you can be a cannabis nurse who owns a business and who owns a cannabis business.
Amazing. Amazing. And I guess oh yeah, that's it for the two Q&A questions because I'm looking at the time. So at this moment, we'll give each of you a chance to do closing comments. Also, there will be an article write-up on this. I have some hot quotes. If I was looking off cameras, because I was kind of taking some prime time quotes for all of you to be featured. But before I guess I give the floor to all of you to have this conversation, to have your closing comments, I do want to take a moment to thank all of you for supporting this conversation. When I entered into this cannabis industry, it took a lot of work to convince my father to create a company together. And when we're going through this, we know that we have to kind of support the marketplace of ideas to help provide the benefits outside of the psychoactive benefits of the plant. Talk about healthcare, the environment. So, I've been looking into the benefits for textile clothing as well through the hemp industry. There's the Declaration of Independence is written on hemp and things of that nature. So this is kind of like a coming back to nature moment and hearing all of you leveraging your subject matter expertise in the healthcare field. It really is, fulfilling and really wholesome to hear all of this work and all the conversations and things that you're all doing. So I do want to take a moment to really pause the program and give you all your flowers for all that you're doing, because these conversations are so critical, not only for this industry, but for other people just to become aware and kind of help, demystify a lot of the propaganda that's set up within people's minds about the plant. And hopefully that could help bring upon the renaissance to help uplift our emerging industry. With that being said, I'll give yes, AJ, do you want something to say? Yes.
I just wanted to add one time before we end. My email address is blackwestchester@gmail.com. I'm welcoming all of you who want to write anything about educating our community, advocating for our community, talk about legislation perspective that you want to write. I will definitely publish on the website, and depending on what time it is, I might even be able to get some of it in the newspaper. So we're the voice of the people, but we're not trying to be just the voice of the voices. We want to give the voiceless their own voice. We want people not to look at this as my paper, but the community be like, that's our paper. So this is a topic that I don't know a lot about, and I've learned a little bit here, and I'm sure this only scratches the surface. So I'm welcoming all of you who want to share anything that can educate our community, because we definitely need that. I'm here for you.
Agreed. Yeah, and also AJ resides in Mount Vernon, which is home, AJ, if I'm correct, to Montefiore School of Nursing as well too. So there's a lot of potential outreach to let people that are going to nursing school to know that this exists, in terms of this cannabis specialty with the nursing profession. So that'd be great. But so in terms of closing comments, we'll first go with Safita, and then we'll go with Chairwoman Wright, and then Kibra, and then Ashley, you will close us out. So first, Safita, the floor is yours.
Sorry, I was muted. Thank you. I just wanted to really quick say, get civically engaged. As we said,
Yes.
politics plays a very big role in what we're seeing and what the future would look like in cannabis. Running a political party, focusing on cannabis you learn a lot when you're lobbying in DC, and you realize there's not enough of us that are advocating. There's not enough of us that are out there telling those that are making the decisions that dictate everything in our communities what we actually need. And so get civically engaged, make sure that you are getting involved locally. Local politics matter most. It's important to elect a president, but you have to be engaged locally in what governs your community directly. So get engaged. If you haven't already, make sure that you make public comment on the reschedule. The federal rescheduling comment period ends on July 22nd. So make sure that you go and make public comment about the reschedule, because we're pushing for a deschedule, which would fully legalize cannabis and decriminalize cannabis federally. And that's all I have.
Well, thank you again for having me here tonight, and for allowing me to be a part of this conversation. This is exactly what I believe we need all over the state. We need people engaging in conversation so that we demystify cannabis, but we also encourage and expose people to it. Part of it is a learning process for all of us. I'm so happy you said get civically engaged. My very first task as an elected official back in 26, right after I won an election in 2016, was go get those folks with the marijuana possessions, get their records erased. That's what somebody came to my house to tell me after I won the election. And so that began my journey. And so we all enter it from a different space, but it's all equally important. And the message that we're all sharing is going to have a tremendous impact on all of the listeners, and it's going to have different impacts, and the reach is going to do exactly what it needs to do. So thank you. AJ, we might be taking you up on that offer. So
absolutely.
Thank you again for that. And I really do look forward to the growth and the development of our patient care conversation here in New York State.
I just wanted to say thank you to Black Westchester Magazine and Chairwoman Wright and Safita and Ashley and Mayor Howard in her absence. I don't know if she joined us. But it just was a beautiful conversation, and we need to have more of them and to continue to be engaged, as Safita said, and don't think that you can't make a difference. You absolutely can. Your voice, especially if it's knowledgeable and it's in line with what your community wants and needs, is very important, and it needs to be heard. So make sure that you're engaging with your elected officials, and as AJ said earlier, if they're not doing what you want, get rid of them. Make sure you get some new ones, but know that you have the power to really make a difference in not just cannabis but your community in general.
Yeah, I also want to kind of ditto that. I really appreciate everybody's input and perspectives around the topic. I think having those intersectional conversations where everybody brings what they have to bring to the table is important. I also I always take things from through the healing lens, and we're talking about individual healing, community healing, and then global healing. And at the end of the day, what we can contribute starts with ourselves first. And so taking just a second to say, okay, how can I support my own healing journey? How can I resolve any maybe trauma or hurt or pain that may have come with my relationship to cannabis or to family or whomever? I think is a good place to start if you're not out here, ready to necessarily engage with our civic system, because once we start to engage, then we have to truly advocate, and we have to advocate on behalf of ourselves as well as the people that we're in support of. So I just want, if you're ready to go out and you're ready to engage the way that these lovely people have suggested, that's great. If you feel overwhelmed with that task, just start with yourself. Take a second to breathe. Take a second to meditate. Take a second to go on a walk. Take a second to choose something different than you would have chosen before, whether it be cannabis, even if it's the method of consumption that you choose, right? And the last thing I want to say is around options. Just know that you have them, even if it seems like you don't. And so that's where education comes in. And so, yeah, that's it. And if anybody wants to contact me or reach out to me, I'm on Instagram at your cannabis nurse, BLISS, and let's reignite. So yeah, that's it.
Thank you all, and thank you for taking your time out of your schedules to support this important dialogue. We will be in connection with all of you. Thanking you all, and also I do hope everyone takes up AJ's offer. You know, he lets me write Black questions articles on environment and environmental whistleblowing on some, on important environmental justice issues. So it'll be great to kind of see, a Black perspective on the nursing profession for the cannabis industry. That'll be really dynamic for me to see, and I'm pretty sure other Black residents in Westchester County will be happy to see that as well too. So with that being said, AJ, do you want to make any comments and close out the program?
No, I'm very honored to have been part of this conversation. I think this is an important conversation. This needs to be the beginning of a conversation, not the ending. As time permitted, and we just scratched the surface. I'm sure each of you, I could have spent an hour with each of you. You know what I'm saying? But we all have such dynamic backgrounds. So again, the offer stands. Anything that I can do to help to get the word out. Y'all know a lot more about it than me, so write something and I will definitely publish it.
Thank you.
Thank you for the offer.
Absolutely.
All right, so thank you all. I'm going to close off the live stream, and again, I really appreciate this dialogue. Thank you, Safida, again, for manifesting this dialogue into
Thank
reality.
you.
We're just having a casual conversation, and we came together with a full blown program. So thank you, and thank you all. And we hope that this is the beginning of a good partnership in order to get this critical information out to members of our community.
Yes, thank you so much, Paul. And thank
Yes,
you,
thank
everybody.
you. Thank you so much.
Mhm.
Oh,
Yep, the video's off. Its video has ended.
Awesome, awesome.
I'm looking at your Facebook page now.
Perfect, perfect. And I think we're all set. The recording I think the recording is stopped as well, or
No, you have to stop the recording yourself. I'm
oh,
sending it
okay. I thought I did. Oh, yep, I think it stopped. I know I pushed the stop button, so all right, so I'll save the video. I'll clean it up as well too. But thank